The sensor that you are making emits light, infrared light, that will pass through the skin and nails and bounce off of the red blood cells. The red blood cells have hemoglobin in them, and the hemoglobin within the blood is what binds to the oxygen and then is transported throughout the body. What we are measuring is the amount of hemoglobin that is saturated with oxygen. So this is what the sensor looks like when it is totally put together. And inside is the little infrared light that you see. And what we do is we place our patient's finger in there. And as you see on our monitor over here, it will start tracking my pulse. You can see the bar over here going up and down, as well as the percentage that is saturated. It will also give my heart rate because it does sense that as well. So let's take a moment and think about why is assessing a patient's pulse oximetry an important piece of information that nurses and physicians will use in helping treat our patients. So I'd like you to take a few moments to write down why is it important for physicians and nurses to have this information. What does this data help us do for our patients when it comes to treatment? Normal pulse oximetry is anywhere from 90 to 100%. We actually like to see the ideal of being 94 to 99%. Anything less than 90% is cause for concern when it comes to patient care. Usually disease processes affect our patient's ability to oxygenate well. We don't like seeing a pulse oximetry of 100%. 100% pulse oximetry means my hemoglobin is saturated to the fullest. If that happens for a prolonged period of time, our patients can develop oxygen toxicity. For adults, it's not as concerning as it is for infants. Infants who have high oxygen levels for a long period of time can develop issues with their vision at a later time. So, what are some things that can cause my patient's pulse oximetry to drop? So, we can see patients who have asthma, who are having an asthma attack. We can see patients who have emphysema, who have issues again with oxygenation. And it's usually related to exposures, whether it be cigarette smoking, exposures at work, working in a foundry. And vaping is a really big thing, and we don't know what happens to the lung with vaping because it is so new. It too could affect your patient's ability to oxygenate well. One of the other ways that our patient's pulse ox can decrease is what we call a pneumothorax. And a pneumothorax is when my patient's lungs collapse. So as you can see here, my patient's lungs are fully inflated and we are breathing well. If I have a patient who has a pneumothorax, another reason that our patient's pulse oximetry may decrease is a pneumothorax. And that can be the result of a penetrating trauma, such as a gunshot wound or a knife wound, or blunt trauma, which could be the result of being punched in the chest. What happens at that point is the lung itself collapses. So as we will see here, this is what normal lungs look like underneath the pleural covering. Let us go ahead and take a look at our left pneumothorax. As you see, the lung has collapsed, and as a result, my patient's pulse oximetry has decreased. How do we fix this? One of the ways we do that is putting in a chest tube, and what that does, it will take out either fluid or air and will allow the lung to reinflate. Once we have resolved our pneumothorax, we're going to see our patient's pulse oximetry increase. So the patient is oxygenating much better. Now, if I have a patient who is having a low pulse oximetry, fingers are usually the ideal place that we like to monitor our pulse oximetry. Some things that might cause us to have false readings or not be able to get a very good reading would be cold fingers, because we are not getting enough circulation to the fingers themselves. Also, people may have fingernail polish on, fake nails, and nail polish will also give us false readings, false elevated readings actually, or it won't pick up the percentage of oxygen at all. It will not pick up a pulse. Purple and red are the colors that will give us false high readings. Why do you think that purple and red are the reasons for getting false positives? Think about that, write down your answer, and we will come back. The reason that red and purple nail polish cause a problem with the sensor, and it is looking at the hemoglobin. Hemoglobin is red and it picks up the color. It doesn't differentiate that it is nail polish on your person's finger versus the fact that the hemoglobin is not saturated fully. Other places we can go ahead and put a pulse ox probe, and these would be disposable probes because they are more flexible, would be your patient's earlobe. We can also do across the bridge of the nose sometimes. For children, we can use the ball of the foot. And what we would do is we would wrap it around the ball of the foot, and we would be able to obtain a pulse oximetry that way. Another way that we may see false readings are patients who have been involved in a house fire or have been exposed to smoke. Carbon monoxide is bound much more readily to hemoglobin than oxygen. We call that an affinity. So the hemoglobin has a greater affinity for carbon monoxide than it does for oxygen. So we can see false readings there as well. If we have a patient who has been exposed to smoke, we will do another test called the carboxyhemoglobin, and that tells us more in detail what the hemoglobin is saturated with. So if our patient has a low pulse oximetry, we said anything under 94, we're okay with, but anything under 90 will cause us concern. We can do one of two things. We can administer oxygen to increase the pulse oximetry, or give medications such as bronchodilators to help open these airways. Right here we see the trachea, which will branch out into additional structures into the lungs. So if I go ahead and administer oxygen and or bronchodilator, I should see my pulse oximetry increase as airways open and oxygen levels increase. Well, if you have any questions, please feel free to send them to Mr. Dorsey, who will then forward them to me. And I look forward to our next video.